All right, so I got some good news. I got some really good news. According to scientists now out of London, some really good. How are things going in your house right now? Because we haven't had a meltdown. No. The kids haven't said, I can't do this. Oh, yeah, really? It's been 4 days. Wait to see what you can actually do. Anyway, we're trying to flatten the curve. That's what everybody's trying to do. We're imposing social distancing to slow the spread of the virus so the number of people sick doesn't cause the healthcare system to collapse as it's threatening to do in Italy and elsewhere right now. That means the pandemic needs to last at a low level until either enough people have had COVID-19 to leave most immune, assuming that our immune system actually will leave a marker in us to say, oh, I recognize that. I can fight that. Last night I had an expert on, said that she's 99% sure that this is going to happen, that we are going to have those markers in us. But we don't know yet. We don't know. This is going to last until we either get those markers in us or until there's a vaccine. So how long will that take? How draconian are things going to have to get? All right. We've been told that it'll be just a couple of weeks. We're just going to do this for a couple of weeks. And I've been telling you, nope, that's not it. We're not going to be doing this for a couple of weeks. We're going to be doing this for a long time. Plan on 8 weeks is what I said. Well, scientists in London have just come out with some new numbers. According to a report yesterday, as long as someone in the world has the virus, breakouts can keep reoccurring without stringent controls to contain them. In the report yesterday, researchers at the Imperial College of London proposed a way of doing this. Impose more extreme social distancing measures every time the admissions to intensive healthcare units start to spike. Then relax them when they start to fall. Every time they rise above a threshold, let's just say, for example, 100 per week, the country would have to close all schools and most universities and adopt social distancing. When they drop below 50, those measures can be lifted. But people with symptoms or whose family members have symptoms would still be confined at home. Now, social distancing, something that we had never heard, but we're used to now all of these new words and phrases just being thrown at us. What is social distancing? Researchers define it as all households reduce contact outside of the household, school, or workplace by at least 75%. Now, that doesn't mean that you don't go out with your friends once a week instead of 4 times. Really? Is that what you got, Stu? Are you getting that from social distancing that, but Fridays are different?
No, apparently not. That's not allowed.
Yeah. Okay. It means everyone does everything they can to minimize social contact, and overall, the number of contacts fall by 75%. Under this model, the researchers conclude social distancing and school closures would need to be enforced some 2/3 of the time, roughly 2 months on, 1 month off, until a vaccine is available. They say that will take at least 18 months. Now, I don't know about you, but my kids are already starting to social distance themselves from me. I can't imagine being locked in the house for 18 months.
I don't think that's
Anybody?
something that we will accept, frankly. I mean, that is this type of thing that we'll just say no. We will just
May
not.
I read the rest of this?
Yes, I know.
May
I've
I
read
read
this
the
report.
rest
It's
of this
not pretty.
happy missive?
Mm-hmm.
Yeah. So surely there has to be some other options. Why not just build a whole buttload of ICUs? Well, it doesn't work. The researchers' model, that didn't solve the problem. Without social distancing of the whole population, they found even the best mitigation strategy, which means isolation or quarantine of the sick, the old, and those who have been exposed, plus school closures, would still lead to a surge of critically ill people 8 times bigger than the US or UK system can cope with. So even if you set factories out to just churn out ventilators and beds and ICU farms, you still need more nurses and doctors to take care of everybody, and we just don't have that. In all scenarios, without widespread social distancing, the number of COVID cases overwhelms the healthcare system. Okay, all right. How about just restrictions for one batch of 5 months? Nope, not good. Once measures are lifted, the pandemic breaks out all over again. This time it's in winter, the worst time for the healthcare system. Now,
Yay!
As I'm looking at this, isn't this, Stu, exactly what China is doing right now? Isn't China in the midst of releasing the herds back out into the wilderness?
Yeah, so we're going to see whether this works or not, because China's basically experimenting with it right now as we speak. And, the big news yesterday was supposedly, again, if you believe China's numbers and what they're telling us, supposedly China...
Don't even use the word. You racists don't even use the word China on this program.
But the numbers are coming from China.
China. Oh, my gosh.
They're coming from
All right, anyway, what did they find?
What they found was 0 cases for the first time since this started of community spread. So that means they did have 34 new cases, but all 34 were people traveling into China from other areas, which might be another thing they may want to consider stopping. And also, why would you go to China at this point? This is not a good...
I know. It's like, oh, man, the savings of seeing the Great Wall of China, and maybe me and the family could be buried inside the wall. It'd be great. Okay, so this, what I don't understand is why we're being told, and I asked the doctor on our special last night, and I don't feel like I got a great answer. Why is it that China is releasing people and they're not experiencing this? Why is it that China stopped this dead in its tracks with a lot more people that already had it? Ours are all just projections. You know what, Stu, looking at this, I'll bet you the people who are doing the modeling on this thing are the same people who are telling us about global warming.
Probably.
But, why is it when we have an actual country where we had thousands and thousands and thousands of people infected, why didn't we have 100,000 deaths in China? But we're supposed to have them here. It doesn't make sense to me.
Yeah, especially when you think of the Chinese lifestyle, right, is giant, massive cities where people are packed into very tight areas, working very closely.
And nobody blinks when you say, I don't know, throw that bat in that soup. Nobody blinks.
Yeah.
It's not a healthy lifestyle in many ways.
Especially for this type of thing. For this type of thing, I mean, there's a reason why we've had. I was saying yesterday, like I really do think it's inappropriate to call it the Chinese virus, because they're going to release another virus in like a year, and we're gonna have to come up with a whole new name for it. So, like, it's just because it's inefficient.
Do you know what MERS is?
Yeah, Middle East Respiratory Syndrome.
I'm sorry, it's what?
Middle East Respiratory Syndrome. Yes,
Middle East Respiratory System. Wow. Do you know what the West Nile virus is?
Yes, I do. Spanish flu.
It's a virus. Yeah, Spanish flu. I mean,
Lyme's
this is
disease.
what we call things.
I used to live 2 towns away from Old Lyme, Connecticut. Lyme's disease.
Lyme, Connecticut.
Mm-hmm. Yeah.
That's where it's from.
Mm-hmm. Yeah,
I mean, this is so unbelievably... I'll get into this in a minute. Let me just finish this stupid thing. All right, so this is going to have a huge impact on people coming together. Restaurants, cafes, bars, nightclubs, gyms, hotels, favors, theaters, movie cinemas, art galleries, shopping malls, craft fairs, museums, musicians, other performers, sporting venues, sports teams, conference venues, cruise lines, airlines, public transportation, private schools, public schools, daycare centers. I mean, are you kidding me? This is the entire thing. Now, they say there will be some adaptation, of course. Gyms could start selling home equipment. Oh, and online training sessions. Oh, okay. All right. It's now being called the shut-in economy. Shut-in economy. It sounds sustainable to me. Now they're saying that we're going to have a better healthcare system at the other end of this. Oh, are we? Or are we going to have a nationalized healthcare system? They say maybe movie theaters will take out half of their seats. Meetings will be held in larger rooms with spaced out chairs. Gyms will require you to book workouts ahead of time so they don't get too crowded. But here's the good news. Governments all around the world, including Israel, have decided to use cell phone location data. See if this matches what you've been saying is coming, Stu. It'll match location data with its intelligence services that they use to track terrorists to trace people who've been in touch with known carriers of the virus. Singapore does exhaustive contact tracing and publishes detailed data on each known case, all but identifying people by name. To get on a flight, perhaps we're going to have to be signed up to a service that tracks your movement via your phone. The airline wouldn't be able to see where you've gone, but it would be able to get alert if you have been close to someone that has been infected or in a disease hotspot. There'll be similar requirements for the entrance of large venues, government buildings, public transportation hubs. There'd be temperature scanners everywhere, and your workplace might demand you wear a monitor that tracks your temperature or other vital signs. Where nightclubs ask for proof of age, in the future they may ask for proof of immunity, an identity card, or some kind of digital verification via your phone showing you've already recovered from or been vaccinated. The intrusive surveillance will be considered a small price to pay for the basic freedom to be with other people. Gig workers, again, this is a report from London. Gig workers, from drivers to plumbers to freelance yoga instructors, will see their jobs becoming more precarious. Immigrants, refugees, the undocumented, and ex-convicts will face yet another basic obstacle to gaining a foothold in society. Bullcrap. Bullcrap. That won't happen. Can somebody, this is another thing I'm going to take on today, can somebody please tell me why we're releasing prisoners? Why are we releasing prisoners? Isn't that the ultimate in isolation? Aren't we just quarantining them? Why are we releasing people onto the streets? Who came up with that idea? I know, it's rhetorical. I know who came up with that. Moreover, unless there are strict rules on how someone's risk for disease is assessed, governments or companies could choose any criteria. You're high risk if you earn less than $50,000 a year, if you're in a family more than 6 people, or you live in certain parts of the country, for example. Oh, another way to separate us, divide us, and keep us in our own little corrals. This is great. That creates scope for algorithmic bias and hidden discrimination, as what happened last year with a U.S. health insurer. They used an algorithm that turned out to inadvertently favor white people. Oh, my gosh.